Hello, my name is Nabil Khan, and I would like to thank the editors of Gut first for accepting our paper, and secondarily for giving us the opportunity to disseminate our findings regarding a study entitled Risk Factors for SARS-CoV-2 Infection and Course of COVID-19 Disease in Patients with Inflammatory Bowel Disease in the Veterans Affairs Healthcare System. The aim of our study was to better understand the risk of infections with all classes of IBD medications and the impact of these medications on disease course. To achieve our aims, we looked at a nationwide cohort of patients with inflammatory bowel disease in the Veterans Affairs healthcare system, which is the largest integrated healthcare system in the USA with more than 9 million veterans every year. It is very apt to conduct such a study because it has established a database of all patients who have tested positive for SARS-CoV-2, and all medical records are retained in a central pharmacy data set. We conducted a retrospective cohort study. We categorized IBD medication use immediately prior to COVID-19 pandemic and used survival analysis methods to study an association with SARS-CoV-2 infection, as well as a combined secondary outcome of COVID-19 hospitalization or COVID-19 related mortality. The analytic cohort comprised of 30,911 patients and was predominantly male with almost 91%, Caucasian at 79%, and with ulcerative colitis comprising 59% of the patients. Over a median follow-up of 10.7 months, 649 patients, or 2.1%, were diagnosed with SARS-CoV-2 infection, and 149, or 0.5%, met the combined secondary outcome of hospitalization or COVID-19 related mortality. In adjusted models, vedolizumab use was significantly associated with the risk of getting SARS-CoV-2 infection relative to mesalazine alone, with a hazard ratio of 1.7. Except for corticosteroids, no medications, including mesalazine, were associated with an increased risk of severe COVID-19. Corticosteroids were also associated with an increased risk of acquiring SARS-CoV-2. The salient findings of this study were that mesalazine use, in contrast to previously published literature, was neither associated with an increased risk of SARS-CoV-2 or severe COVID-19. Corticosteroids, on the other hand, were both associated with an increased risk of acquiring SARS-CoV-2 as well as severe COVID-19. This study reaffirms the recommendation that physicians should exercise caution to use corticosteroids for IBD management during the SARS-CoV-2 pandemic. Furthermore, this was the first study which showed that vedolizumab use was associated with an increased risk of infection with SARS-CoV-2. We feel that with the re-emergence of SARS-CoV-2 and the waning effect of the immunities conferred with vaccinations over time, these findings are very relevant to both patients and physicians who are involved in the management of inflammatory bowel disease during the SARS-CoV-2 pandemic. If you have any questions, feel free to email me. I would like to take this opportunity to thank my fellow collaborators, including Dr. Mahmud, as well as the editors of Gut, who have given us the opportunity to disseminate our research. Thank you very much for your time.